Welcome to DogTalk360 Ask a Vet podcast. In collaboration with the George Animal Hospital, our main aim of these educational sessions are the wellness of your dog, and we will cover a variety of relevant topics applicable to all dog breeds, ranging from habits and behaviors, fitness and exercise, vaccinations and parasite control, to chronic disease and other chronic conditions.
Hello and welcome back. I am your host, Dr. Christian Bluchnoot from the George Animal Hospital, and today I will be discussing dental care. Before we get to that, I just want to mention the section on the website where you can log questions or topics that you want us to discuss. If you have any general questions in regards to the podcast episode or any other topic, we will respond to you per email. Otherwise, I can create a whole episode on the topic that you want us to discuss. So please feel free to make use of this function. Right, so today, dental care. If we talk about dental care, or basically just the health of your dog's teeth, we talk mainly about periodontal disease, which is the condition that results from bad or dirty teeth. So we will be focusing mainly on periodontal disease. But first, I want to mention one or two other things that people normally have questions about. The one thing is, can you determine a dog's age by its teeth? Now, technically, this should be possible, but in practice, it is really hard and almost impossible, except for maybe an educated guess, and I'll explain it a little bit. So when a dog is still very young, under 6 months, they still have their baby teeth or their milk teeth, and then you can basically say, listen, this dog is less than 6 months old, or by looking at the amount of adult teeth that has been erupted, you can kind of guesstimate how old the dog is in terms of months. But the moment your dog has its adult teeth, a vet can only guess the age by looking at the wear and tear of the teeth. Now, this will differ from dog to dog depending on the dog's habits and surroundings, the food it eats, the things it chews on. So that becomes really, really hard to say exactly how old the dog is. In an elderly dog that starts to lose teeth or has a lot of wear on its teeth, you can again say, okay, listen, this is an older dog, so maybe it's older than 10 years or older than 12 years. So it's a very wide guesstimate. It's impossible to really say this dog is 6 or 7 or 8 years old. So just a note on that. And then one other thing that I want to mention about age-related changes, like I already said, dogs will start losing their baby teeth by around 6 months, 7 months. They should have all their adult teeth. So if your dog still has baby teeth after 6 or 7 months, it might be wise to have these teeth removed. We call them deciduous teeth, and it's often the canine teeth that is still sitting in the mouth next to the already erupted adult teeth. And this can be a source of discomfort and also a place for food and stuff to sit. So it's quite important to get these teeth removed as soon as possible then. Right, so first of all, what is periodontal disease? I'm going to guide you through the step-by-step process of how it develops, and I think this will explain the condition best. So basically what happens is a dog that has poor mouth hygiene, and this is really common in dogs, and you can expect it to happen in most of your pets. It's the most common health issue in dogs. So you can prepare yourself that this is something that you will most likely encounter with your pets, especially your smaller dogs. They have a very high chance of developing periodontal disease. Anyway, so first of all, you get poor mouth hygiene, and this will then progress to a bad breath, and from a bad breath it progresses to plaque building up on the teeth, and this plaque creates a perfect environment for bacteria to thrive in. We call it a biofilm. So bacteria thrives in that plaque, and eventually the plaque progresses to become a hard, almost like cement type of substance that we call tartar or calculus, and this forms on the sides of the teeth, and it's really hard to remove this. That is then again a perfect place for bacteria to thrive in. And eventually the gums next to this calculus or this tartar becomes irritated because there's inflammation occurring in the gums. The body is telling the gums to react and try and protect itself against this bacteria, so it causes inflammation in the gum line, and then the gums become really tender, they become red, eventually even bleeding, and then the gums will start to retract away from the teeth, and you'll even see the teeth roots exposed. And at this stage, teeth becomes loose, and eventually the teeth will fall out or appear rotten. So this is the process that happens, and this is basically what you'll see in a periodontal disease. And your pet might have different stages of this, and you'll be able to identify it quite easily if you use this process that I just described as an explanation for it. It's very important to keep an eye on this, especially in older dogs. Anywhere from 3 years onwards, they will start to show signs of this, but after 10 years of age, definitely something that is common, and I would say in more than 60 or 70% of dogs. And it's especially in your smaller breeds. It's not well researched yet, but it appears to be more common in your toy breeds or your house dogs than in your larger outdoor breeds. So what are the signs of periodontal disease? I've already mentioned some of them in the previous explanation, but I'll just go through the whole list quickly. Look out for the following: bad breath, sensitivity around the mouth area or pawing the mouth, decreased appetite or difficulty in chewing, especially hard foods like pellets. And you'll see a yellow-brown deposit on the teeth, which can be the plaque, and even almost like a cement-like deposit on the teeth, which is the calculus, you'll be able to see. And then obviously also bleeding gums, red or inflamed gums, gums drawn away from the teeth, exposing teeth roots, and then also loose or missing teeth. And I already mentioned pawing or experiencing discomfort around the mouth area. In severe cases, I've also had clients that said they found teeth in their dog's food or lying on the grass outside, and this is really bad, and you know there's something wrong in these cases. So please look out for any of these signs, and if you are uncertain or you suspect that your dog has periodontal disease, please visit your vet for a routine dental checkup. Now, that is the next part of our topic, preventing or treating. Now, this is important. There is ways you can prevent a dog developing periodontal disease, but in certain cases, when it's progressed too far, these preventative measures won't help to solve the problem, and you will have to visit a vet. So things that you can do to keep your dog's teeth healthy is number one, which I just mentioned now, is go for routine dental checks by your vet. It's quick, it's easy, and you'll know for sure what the state of your dog's teeth is in and if it's needed to do any further procedures on them. You can brush your teeth at home. This is easier said than done. I'm going to be honest about it. Some people find it easy, but I think it depends on your dog, and I think more often than not you're going to have trouble to try and do this, but it's worth a try. If you're going to brush your dog's teeth, brush for at least about 30 seconds, so I'd say 2 or 3 times a week. Please do not use human toothpaste. Get the toothpaste from your vet stores, and even toothbrushes that you can buy from your vet. There's also oral gel, so if you struggle to brush your dog's teeth, you can apply this oral gel straight into the mouth. It can just basically help flush bacteria and dirt out of the dog's mouth. And then there's also other things, dental chews or treats, which is important because this can help clean the teeth. To buy these dental chews from a vet store, and even toys, rubber toys, rope toys, all these type of chewable toys that helps to keep your dog's teeth healthy and clean. And then diet can also play a role. So if you feed your dog a lot of table snacks, anything that contains a lot of sugar, just like with people, this will cause problems, especially for the fact that dogs don't brush their teeth twice a day. So please avoid giving them table scraps and food from the table or anything human food. Sticking to dry pelleted food is best. If you use wet food for your dog, this can have a little bit of an added effect if there's already periodontal disease brewing, because the dry pellet food just helps to brush or kind of grind away that dirt on the teeth. So try sticking to a dry pelleted diet. In older pets, there's even certain diets that's formulated for dental health that you can ask your vet about. These are prescription diets that you'll only get from a vet store. Now lastly, if your dog has periodontal disease or there is any issue with its mouth, you need to visit a vet. And from this point, there will be a discussion about all these preventative measures that I just mentioned. But if it reaches the point where there's calculus or tartar that is already built up on the teeth, then none of these previously mentioned measures will get rid of it. You have to actually book this dog in for a dental procedure. Now, how this will work is your dog will, depending on your vet, will be booked into the theater in the morning or whenever, and then they will be sedated with a light sedation, normally injectable sedation or gas in an older dog or a compromised animal. Then the tartar and the calculus will be removed with a dental drill and specialized dental instruments, quite similar to what you'll see in a normal human dentistry practice. And then there will be assessment of the teeth done. Any loose or rotten teeth will be removed or extracted, and then your teeth will be polished and the mouth will be flushed before the animal is woken up after the procedure. And if in severe cases it's needed, the pet will go home on painkillers or anti-inflammatories and antibiotics to get rid of any infection. And this is basically the procedure. So if your dog gets to the point where you can clearly see there's like a cement-like substance on the teeth, which is called calculus, then this is a non-negotiable. It'll only get worse from this point. It won't help to feed it chews or brushing or any of these things. It's already gone too far. After the dental procedure, you can start with all the preventative measures again. And this is basically it for teeth dental health. There's one or two other things that can go wrong, but in general, periodontal disease is the problem that many owners struggle with. So if you have any further questions, please submit them to us, or just drop by and have your dog's teeth checked out. Thank you very much for listening, and see you next time as we will be discussing lumps and bumps. Goodbye.
For more information, visit our websites dogtalk360.co.za and georgevet.co.za. Also follow and subscribe to our social media platforms for DogTalk360 and George Animal Hospital. DogTalk360. Best advice, best training, better dogs.